And if for some reason you are unable to join us through Zoom, you are more than welcome to join us on Facebook. And this recording will also be cataloged in our YouTube channel that we will send out at the end of this webinar. Well, without further ado, it is the noon hour. Good afternoon, everyone. My name is Deborah Levine, and I am the director of the Harlem Health Initiative for the SUNY School of Public Health and Health Policy. And I want to thank you all for joining us this day for our webinar on how am I doing, why nonprofits should measure performance and implement a performance management system. We're fortunate enough today to have with us our guest, Sylvia Pirani, who is a public health practice consultant and has agreed to share her talents, her knowledge, and her skills. This webinar will be an hour, and we will be sure to include for you a question and answer period. We ask that you please stay on mute during the presentation. If you have questions, please feel free to put them in the chat, and we will be happy to answer them during the question and answer component. So without further ado, I turn the floor over to my illustrious colleague as she begins to give us this fabulous presentation today.
Thank you, Deborah. I hope everybody can hear me okay. Great. I'm really happy to be here today to talk with you about how government and nonprofit organizations can develop and implement a performance management system. This presentation is adapted from one developed for the local health departments of New York State on behalf of and paid for by the county health officials of New York, NYS-SPH, and the Region 2 Public Health Training Center. Local health departments in New York and in the nation that want to be accredited by the Public Health Accreditation Board have to establish and use a performance management system. And this presentation was developed as an introduction for them. But performance management is something every organization should do if it cares about meeting its goals. Many, but not all of the examples are definitely focused on public health in this presentation, but I think they will be relevant to your work as well. So before we get started, Deborah is kind enough to help me at the very last minute to set up a poll. So we had some questions for the audience. So let's see how this works. So the first question is whether health is part of your mission statement. And just go ahead and answer these questions if you could. It just helps me get a little sense of who's in the room. Does your organization regularly measure performance? And has your regular set of programs and services been turned upside down due to the pandemic this year? So we'll wait a little bit longer. Deborah, you have a better sense of how many people are in the room, and oh, there's a couple more still voting.
Sorry, just giving people an opportunity to respond. So if there is anyone else, I will close the poll.
Okay, so many of you have health as part of your mission statement. That's great. So this will be relevant to you, and I hope it's relevant to everyone else as well. Does your organization regularly measure performance? More than 3/4 of you. And has your regular set of program activities, the work your organization does, been turned upside down to the pandemic? More than 3/4, and that's not surprising. Great, thank you. So I'm going to continue with this presentation then and hope this is relevant to you. Performance management uses data for decision making by setting objectives, measuring and reporting progress towards those objectives, and engaging in quality improvement when the performance does not meet the objectives, when your desired progress is not being made. So why should you manage performance? Because performance management can help you achieve your goals. I'd like to start with a story about 2 different counties and how they approached addressing the health impacts of changing demographics in their communities. Recent census data confirmed that each county was experiencing an increase in the percent of the population that was over the age of 65. In Blue County, the health department established a goal to improve the health of the older population, but they did not set specific objectives to measure this health improvement goal, which would help them assess progress. In Red County, the health department established a goal to reduce falls and a specific objective to reduce the rate of hospitalizations among the population due to falls by 25% in 5 years, from 200 per 10,000 persons to 150 per 10,000 persons. Both counties talked with the healthcare providers in their communities about the older population and about how to address fall risks. Blue County hoped that their messaging would make a difference. Red County, in addition to doing the messaging, measured changes in injury rates among the older population and could see that in specific parts of the county where providers had incorporated the screening, rates were starting to drop. When a foundation in the state offered funding to support local health departments to implement an injury prevention program for this population, the county executive in each county urged the health department to apply. Red County was prepared and able to compete successfully for the grant because it could show specifically how its efforts had made a difference and where. Blue County was not successful. As a result of its performance management activities, Red County also now knows the specific places where they need to focus their efforts going forward in order to continue making improvements. Performance management takes some effort. You know much better than I do how COVID has made it difficult to maintain your core responsibilities and services, much less regularly manage your performance. But performance improvement can help you address some of COVID's challenges as well. If your organization was hosting a vaccination clinic, for example, or distributing food, measuring attendance at the clinic, or measuring how many people came in to take food donations would help you improve those processes. While establishing and implementing a performance management system for your entire organization is challenging right about now, the lessons in this module can assist you in using performance improvement for some of your specific current goals. The material in this session is condensed from 2 original sessions. By the end of the hour, I hope you will be able to describe the key components of a performance management system, define and know how to develop goals, objectives, and performance measures, understand how to use Excel as a tool to track progress on agency objectives, as well as some other tools that you could use, identify how to use data from the performance management tool to take quality improvement actions. And we'll just have a moment to touch on this last bullet. So I'm going to review the components of a performance management system and define key terms, goals, objectives, and performance measures, and discuss how to develop them. In the second part of the session, I'm going to review sample goals, objectives, and measures used in a plan, describe how to use Excel to develop a tool to track the progress, and briefly touch on what to do with the data you're tracking so you can make improvements. As mentioned earlier, performance management is about using data to improve performance. A performance management system uses data to be more accountable, to manage systems and services, and to improve an organization's activities. The first definition shown here from the Public Health Foundation is about improving effectiveness, how to use data to improve your organization's ability to achieve its missions and goals. It focuses on the we. Performance management is a group activity, and I'll say more about this in a minute. The second definition is specific to public health, using data to assess and improve the public's health. The public's health may not be your organization's goal, though I would argue that I think all of the work that your organizations and the organizations that work with Deborah are seeking to improve health, maybe in a roundabout fashion. But you can fill in the blank here. It's the practice of actively using data to assess and improve ... whatever you're working on, your organization's missions. Performance management can be used to prioritize and justify why you need resources and for what particular set of activities or services. It can help you identify ways to adjust your efforts or change direction to achieve your goals. It can be used to communicate the work you're doing with your managers, with your stakeholders, with your customers. And it can improve the information. It can provide you with information to improve what you're doing. It also can help you if you have accreditation as one of your requirements or certification, it can help you with that. As described in the example of Blue and Red County public health agencies from the beginning of the presentation, performance management is the opposite of leaving things to chance. This graphic describes 5 components of a performance management system. This was developed for public health agencies, but I think it's relevant for performance management for any organization. On the top left, it's about setting organizational standards and objectives across all levels of the agency or the organization. At the top right, it's about identifying measures or indicators to assess progress towards achieving those objectives on a regular basis. And we'll talk about how to do that later on. At the bottom left quadrant, it's about identifying the responsibility and a data tool for monitoring and reporting on progress. And in the bottom right, it's about using that data to identify areas where achieving your objectives requires focused quality improvement processes. Around the entire process is visible leadership to engage staff for ongoing performance management. So today I'm going to describe how to link your standards to goals and objectives, and then select indicators to use to measure progress. And then we're going to talk about how to monitor those measures and to report progress. And I'm briefly going to touch on quality improvement. I want to say a little bit more about leadership and staff involvement. To be successful in this endeavor of performance management, you need to believe in the benefits of it, and you need to inspire your staff to participate in the development and implementation of the system. If you're a local health department and you're applying for FAB accreditation, you need to be able to demonstrate that you've involved your staff. This isn't a one-person show. It's too much work for that, but also people want to see that this is spread throughout your agency. You need to be able to inspire your staff to participate in the system. This includes communicating the purpose and the results. You want the staff to own it as well, which can be demonstrated by giving them concrete responsibilities for the development of objectives and for reporting data to assess progress. They can also be leaders in developing and leading the quality improvement efforts. So the first stop in the process is the top left quadrant. Where does your organization want to be? To complete this part of the process, you need to identify standards and set goals and objectives. You can set your own standards, goals, and objectives, or you can use those set by national or state organizations. You will have done this if your agency has developed a strategic plan. Standards establish expectations for performance. For example, in public health, the Public Health Accreditation Board sets standards that define what is expected for all public health departments that want to be accredited. Your organizations might have a set of national standards or state standards that you're required to meet for accreditation or certification. As shown at the bottom of this slide, you can have descriptive standards or you can have numerical standards. An example of a descriptive standard is that every program should work to ensure that families feel physically and psychologically safe. A numerical standard is the foster care agency will interview 75% of all families about their safety. These are standards, these are not objectives. We'll get to that in a minute. These help set the stage for the next steps in the performance management system. And the next step are goals. Goals are broad expectations for what you want to achieve as a result of an initiative or service or program. A goal points to a general but not a specific direction, and sometimes they can be abstract and they're difficult to measure, such as the first example at the bottom. A goal being to promote health by improving opportunities for physical exercise in the community. You might not know what opportunity means, what the community, how the community is defined, or how you're going to measure health, but that's your goal. In your organizational plans, your strategic plans, you might not have standards, but you will have goals, and they can be the same thing if a goal establishes the expected performance. So the second example there is just that. The health department will work with the housing authority to increase opportunities for physical exercise in the community. That's a goal and a standard at the same time. And I know these distinctions may be challenging. It's important to define these terms though, because they can be confusing as you move forward. Goals are the foundation for establishing objectives. So you're going to have standards and or goals in many kinds of plans you use in your work. At the right, this was one of the organizations that had signed up to participate today. They have a strategic plan which sets expectations and directions for the agencies. Mission and value statements also describe your agency's goals, and they can be used to set goals and standards. Some of your organizations may have contributed to or led a community needs assessment or a community health improvement plan. These can also contribute to goals, and they'll have specific goals in them. And just to say again, you don't have to start from scratch. National standard documents such as this one for child welfare organizations can also be used to develop standards and goals. So again, standards and goals can be set based on national, state, or scientific organizations, by benchmarking against similar organizations, or by other methods. How you select them is something you need to think about. You could establish a performance management committee with staff from key areas in the department to assist in this process and to ensure they own the process. Another way to do this is to use your organization's plans, including your strategic plan, as well as any key program plans, to identify the specific goals you want to establish objectives for, that you want to include in your performance management system. If you're a local health department, and you're applying for FAB accreditation, you need to show the breadth of your department in this performance management system, but I urge you to start small. You could start with a couple of goals from the strategic plan. You could start with a couple from key program areas, and maybe a couple from administrative areas such as personnel. And here are some examples of the areas you could select standards and goals from. You could pick a goal for improved health status in the community from a needs assessment. You could pick a program capacity goal, such as the organizations contributing food to a food pantry. You could have maybe you have a workforce development plan, and you could certainly pick administrative goals, improving the timeliness of paying invoices, for example. So these are just some examples, and we'll show a completed plan in a little bit. So the goals that you've just established now are the foundation for establishing objectives. An objective is a specific result that you want to achieve. It's more narrow and more specific than a goal or a standard. It points to a specific direction you want to go in. You see the examples at the bottom of the slide here. A program objective could be to work with multi-unit housing owners to implement smoke-free housing policies by 10% in 3 years. Or you could have a community health status objective to decrease the percent of county youth who are obese or overweight from 33% to 25% by 2024. Objectives need to be SMART, and I'm hopeful that some of you have used this acronym before or have heard about it. They need to be specific, so you know what activity you're conducting and with whom, who's the target population. They need to be measurable, so you can quantify progress and quantify success. They need to be achievable. Don't set a pie in the sky objective. You want to be able to actually achieve it or make progress towards achieving it, given your current resources and your constraints. The objective needs to be relevant. That is, the activity you're doing needs to get you to the result you want. They need to be related. Seems obvious, but sometimes it's not. And finally, they need to be time-bound. They need to have a specific time frame in which you will achieve the goals. Is it annual? Is it in 5 years? Is it quarterly? It needs to be specific. So this is a neat way to show you the differences between goals and objectives. Goals are broad, while objectives are narrow. Goals point to a general direction. Objectives point to a specific direction. Goals are abstract, while objectives are concrete. Goals are difficult to measure and often have the end result, the big pie in the sky sort of end in mind, where objectives are measurable and have incremental results. Goals are often derived from long-term outcomes or impacts, where objectives are usually shorter term, but we'll get to that in a minute as well. Now we're going to talk about how you establish these objectives. To create an objective, you start with a performance measure. A performance measure is a quantifiable indicator used to track the progress of program activities toward the achievement of your goals. A measure tells you what you are going to count. As shown in the examples, they don't have a time frame or a direction. So here are the examples of performance measures. The number of multi-unit housing owners that have implemented smoke-free policies, the percent of county youth who are obese or overweight, the number of home visits completed by the foster care program. So these are neutral, they don't have a value attached to them, and you don't have a time frame or a direction. Performance measures are embedded in performance objectives, and I'm going to show you this in the next slide. Performance measures are also sometimes referred to as performance indicators, and they are the same thing. So a measure is the same thing as an indicator. To make the measure, the performance measure that you just established, into an objective, you need to have metrics. This includes baseline data, which is data from the past on your performance. You need to have current actual data on your current performance, which then helps you to determine what your specific measurable goal is, your target. As noted earlier, an objective needs to be time-bound, so you need to identify a time period in which you're going to work to achieve this target. It could be monthly, it could be quarterly, it could be annually, it could be more than annual. In this example, your agency was completing 13 home visits a month, but in the most recent period, because of some training, staff were starting to increase the number of visits they were able to perform to 15. So you feel, based on this performance, that you could achieve 18 visits a month. So as noted earlier, the measure is a neutral indicator of performance. And here you see the measure at the bottom of the slide, the number of home visits completed by the foster care program. At the top of the slide, you see the objective, which includes the measure, shown in red. There needs to be agreement between the measure and the objective. The measure is extracted directly from the objective if the objective is written well. So the objective here is to increase the number of home visits completed each month from 13 to 18 by the end of 2020. And you use that data, your baseline, your actual, and your target to create that objective. Here are some additional examples. This is about increasing smoke-free policies in multi-unit housing. So the measure, starting at the bottom, the number of multi-unit housing owners that have implemented smoke-free policies. And you see in this community or in this county, maybe there aren't a lot of multi-unit housing there, the baseline was 1. They were able to persuade 1 co-op board to implement a smoke-free policy. They actually think, based on that success and lessons learned, they could do 2 a year, and they want to get to 6 by 2022. So the objective now is to increase the number of multi-unit housing owners that have implemented smoke-free policies from 2 to 6 by 2022. So you see the measure in the objective. And here's a third objective with the community health status indicator. The measure is the percentage of county youth who are obese or overweight. You've got your baseline data. It's gone down a tiny bit. And based on a number of factors, they've determined that they think they can get to 16.7 from 19.5 by 2024. So the objective then is to decrease the percentage of county youth who are obese or overweight from 19.5 to 16.7 by 2024. These are just examples. And remember, they need to be SMART. They need to be specific, measurable, achievable, relevant, and time-bound. So with regard to the time-bound aspect of this, don't overpromise and say you're going to achieve an improvement monthly when you know you both can't do that because you don't have the capacity to do the work or to measure the results. Think about the frequency with which you can do both, do the work and measure the results. So that's really important. Measures can assess short-term, intermediate, long-term outcomes or impact. And you can develop these kinds of objectives for each of these areas. Short-term outcome objectives, and this may be hard to read, but we'll make sure you get the slides later. Short-term outcome objectives measure short-range changes resulting from a program, such as new knowledge or attitudes about a behavior that contributes to a health problem. So maybe your activity was to do training, and you can measure new knowledge or attitudes. That's a short-term outcome. Intermediate outcome objectives assess changes such as new or different actions or behaviors that result from the program. You went to a training about exercise, and now you're actually making a commitment to do exercise a couple times a week. Long-term outcomes measure changes in health status or conditions resulting from the program. So now you've actually seen some reduction in obesity. And impact objectives assess organizational, community, or system changes that result from a coordinated set of program changes. So you've done you've led training on exercise, the importance of exercise, but you've also created systems to encourage people to exercise. You've set up some exercise challenges. So that's a systems change you're going to measure in the impact, with an impact objective. It can take a long time, those of you in public health know this, to achieve your long-term outcome objectives. Reducing obesity, for example, takes many years. I would recommend having a mix of short-term, intermediate, and long-term objectives that will help you assess the effectiveness of your intervention along the way. Don't just focus on short-term, or long-term, but have a mix of those objectives. And if a program or an intervention functions as you hoped it would, achieving your short-term or process objectives should lead to achieving intermediate and long-term objectives, as well as outcome objectives. So that's a lot in a very short amount of time in terms of how you find or create standards, goals, select performance measurement measures or indicators, and create your objectives. And the second part of this process now is now that you have developed performance standard goals and objectives, is to come up with a way to collect the data and measure performance. So here's an example of a set of performance measures that a local public health department someplace in the Midwest came up with. And this shows the breadth of the programs that they deliver. So they have an administration program, they operate community health centers, they have an environmental health division, they have a preparedness division, they have a home health care program, and they have a communicable disease program. And these may or may not be relevant. For example, I know they're not all relevant for the New York City Department of Health and Mental Hygiene or other local health departments in New York State, but it's just an example. So you have your key program areas on the left. These are the objectives with the measures included, and then the targets on the right. This shows you that the department wanted to be measuring performance on objectives from their variety of programs, initiatives in the department. And once they come up with this, you come up with your set of objectives, you need to come up with a tool to measure progress. So what is a performance management reporting tool or system? It's a tool used to measure performance data associated with the measures you've established. Pretty basic. I'm going to use some examples here of goals, objectives, and measures to show you how to measure progress using one of these performance management reporting tools. So what you see here is a minimal example of what a performance management system would look like for each of two goals and related objectives. So what you see here is the goal in the dark blue. We have goal 1, increase access to healthy and affordable foods and beverages. That's a general, sort of vague goal. That's what a goal is, right? It doesn't have a measurement. It doesn't tell you over what time frame. It doesn't tell you how you're going to do it, but that's what's there. And then the second goal is more of an internal administrative goal, that they want to strengthen the skills and satisfaction of their workforce, of the agency or organization's workforce. And again, that's a general statement. It's a goal. It's not an objective. Then you see underneath on the left column, the 4 objectives related to each of these goals. So objective 1.1 is to increase the percentage of hospital vending machines that sell water as the least expensive item by 250%, from 22% to 77% by 2021. So the performance measure, which you see in that objective in the second column, is the percentage of hospital vending machines that sell water as the least expensive item. And you see there the target, the baseline, and their performance, their current performance. So their baseline was 22%. They got up to 36%. They feel like they can more than double it to get to 77%. We gave you 4 different objectives here. These are short-term, intermediate, long-term, and impact objectives for each of these goals. So we've given you an example of each one of these. So the first one is a short-term one. First, we have to put the healthy water, healthy items in the hospital vending machines. The second one is an intermediate measure or objective. You want to increase the ratio of water sold. So you actually want the behavior to have changed, the intermediate behavior. Then you've got a long-term objective, is to decrease the percentage of adults who consume more than 1 sugary drink. This isn't just from what they purchase in the hospital, but throughout their lives. You want to reduce that. And then the impact objective in this case is obesity, measured by obesity. And then we did the same thing with the second goal. You're going to increase the number of trainings on performance management, quality improvement in your agency. So once you increase the number of trainings offered, then you're going to increase the percentage of staff who actually got the training. Then you're going to increase the percentage of staff who report that they are proficient in this set of skills. And you're hoping that this leads to job satisfaction. There's been some sense that it does, so that's what your impact objective is. So that's what you see here. This is a minimal example of what a performance management system would look like for each of 2 goals and the related objectives. So this is just minimal, and I'm going to show you how you would get to this. To create a performance management reporting system, you need to consider the methods you're going to use to collect the data, the frequency of reporting for each objective, the goals and responsibilities of staff for the reporting, and the kind of system you're going to use to collect the data to assess progress. It could be an Excel spreadsheet or something more sophisticated, but it needs to be something you're going to use. So there's software packages you can buy. If you have a lot of money, you can purchase these, and this is not an advertisement for any one of these. I have no association with any one of these systems. At the bottom, you see these 2 performance management systems. These are in use by some local health departments. They don't do data exploration, but they're created for performance management systems by local health departments. The business intelligence tools have broader functionality. They're not necessarily designed to do performance management or measurement, but they can do the tasks needed, and they can export data, and you can do data visualization for this. You may have also been given links to software packages to use. If you're a state agency, if you're a city agency, they may tell you what kind of system you're supposed to be using. But you can also just use Excel. And this is what the New York State Health Department, where I worked for many years, is using. In addition to some of the more sophisticated statements, it's got to be something that you and your staff know how and are willing to use and that works for you. So that's why Excel can often be your best friend. So to get to this minimal system here that I showed you for these two goals and the related objectives, you need to have a little bit more information. So again, you've got goal 1, increase access to healthy and affordable foods and beverages. And goal 2 is about strengthening the skills and satisfaction of the workforce. You've got your 4 objectives. You've got your performance indicators. We already reviewed those. You've got your target and your baseline, which we had seen before, but now this is where you're actually going to do the report. So these are all going to be measured quarterly, but you could change that to a different time period. It could be different, could be annually, could be biannually. So this is what you're using to report the data, to put in the number that you're collecting. And then that's what's in quarter 1, 2, 3, and 4. And then in the status column here, you're showing whether you've met it or not. So far, none of these have been met. Reporting protocols, how frequently you're going to collect it, and who's responsible for collecting it. So in this instance, the health department is responsible for collecting data on the first objective, but you have a nutrition program administrator responsible for objectives 1.3 and 1.4. And then you have a learning management system administrator responsible for the first 2 objectives under the second goal, and a health human resources director for the 3rd and 4th objective. You need to have an owner, because otherwise it's not going to get done. Who's responsible for this? This is why this is a group effort. It's not just one person doing it. Okay, so I'm watching time here. I want to make sure we have time for questions. This page is from a guide for how to develop an Excel-based performance management system, which we borrowed a lot of from this presentation, and I have the link on the next slide, I think. Yes, I do. This is the thing. This is the page that you would fill out before you do this page. So this, again, this is just for the first goal, not the second one. You have your objectives, you have your measure or indicators. This tells you the type of measure to make sure you have a short-term and intermediate, a long-term, and an impact. This defines the measure. It tells you what the measure is that you're trying to use, the purpose of the objective, or the rationale for having this objective. This tells you what you're counting, the numerator and denominator, and how you're going to do the calculation. This is pretty basic. You need to have this figured out. And then the data source, how you're going to collect the data collection methods, whether this is by county, by hospital, by block, you could figure that out. And then again, who owns the data. So we're showing you these sheets in the reverse order to show you where you needed to end it up. So this is the first sheet you would do. And I want to show you that if you use this tool, there's instructions for, you know, all the things that need to go into these sheets. But let me just go back here for a second. This is the first sheet you would need to do. It's the metrics and protocol tab. Then you would have a tab for performance monitoring once you picked your objectives and figured out how you're going to calculate them and do all the steps here. And where you end up is this. This is the kind of thing that you could use to communicate with your colleagues, your community, your boss, about what you have achieved. So we've now completed the performance standards and the performance measurement. We don't have much time for these last 2 steps, but how you're going to report the progress then that's on this sheet, you could just distribute it to your colleagues. You could figure out how to put it on your website. You could use it at your monthly staff meetings. You need to figure that out. Before you figure that out, you need to figure out who's going to do the analysis and the interpretation of the data. Then you're going to figure out how it's going to be reported. And then how are you going to use the data to make decisions? So have you achieved your objectives? If you haven't, how are you going to talk to people about it? How are you going to develop practices to give people feedback about what you have achieved and what you haven't achieved? And then how are you going to develop processes for prioritizing and selecting improvement efforts? And quality improvement is a whole nother session. But you first need to set this performance standards and performance measurement and reporting in place before you can get there. So I'm going to stop there and turn it back to Deborah to see if there are questions or comments or concerns or confusion. I hope not too much.
Thank you, Sylvia. I'd like to open the floor for any questions, comments. Please feel free to use the chat or raise your hand and I'll be happy to unmute you. No, Sylvia, it seems we do have for the last quadrant. Can you just speak a little bit about that?
The quality improvement quadrant.
Yes, the last one. Yes, the quality improvement.
Yeah, so for public health agencies, a comprehensive performance improvement, performance measurement system and a performance improvement system would definitely include how you use this data to improve your programs, your policies, the interventions. So you might look at your data and come up with, a cycle, for example, doing plan, do, study, act to assess. You plan your intervention, you do the intervention, you study the results, and then you act to make improvements in it. So that's a very important phase. We didn't have time to go over that today, and I'm happy to talk about it at a later date. It's very critical. There's no point in measuring performance if you're not going to do something about it, right? This isn't just because you need to show your results. You need to be able to continuously improve. That is the goal. I don't know if that answered the question.
Yes, so you have another question. Any tips for those of us working with CBOs that may be a bit reluctant to engaging in the process?
Yeah, I mean, it would be good to know, what could encourage them? Is the potential for additional funding a way to encourage them? They need to be able to show that they've achieved their objectives. It's not, you can't leave it by chance. You really need to, you need to be able to measure results, and maybe you start small, just pick one or two programs or one or two interventions that you could measure progress on and help them track that. Start it very small.
Thank you. I have another question from Ray. How often is this work plan revised related to the budget cycle or strategic planning cycle or changes?
That's a really good question. And I think it probably depends on the kind of organization you are. I know local health departments, I think, are required to do strategic planning every 3 to 5 years. If you're an accredited health department, I'm sure there are requirements for other kinds of organizations as well. I don't think you want to do it too frequently. That's just too much work and things may not have changed. I would say 3 to 5 years seems reasonable to me. If you go through it too frequently, you're just going to burn people out. It is a lot of work. Probably depends on the kind of work you're doing for me to be able to better answer that question.
Comment on the Goodhart's Law and the Tyrant of Metrics.
I'm not familiar with that. Can they describe that a little bit more?
Ray, would you like to unmute yourself so that you could ask the question?
Yeah, how's that?
Great.
Good voice?
Yes, thank
Okay.
you.
Goodhart's law says that when you start establishing a lot of operational metrics, is data that starts off as being good exploratory data and measuring what's going on and so on. When it becomes the operational control, if you will, then it ceases being useful and in fact may be counterproductive.
Right.
And I think an example of that I came across recently at a hospital is where they wanted to find out to get more incoming referrals for services, and they figured out what it was, and then they decided they'd like to increase it, definitely. But when that became an operational metric where people were being measured, their performance is being measured on the increase of that, what happened was that people started gaming the system, number one, and quite often they didn't dig deep enough into what they should be managing. A good example was if you just measured incoming referrals, period, and that became your operational metric, that a brand new patient takes a lot longer than a repeat get a prescription filled. So in gaming the system, quite naturally, people then started to concentrate on the short ones, the ones that are easy to do. And whereas in fact, the original goal would have been to get brand new patients. That's just a good example of that. And The Tyranny of Metrics is a pretty good book.
Yeah, I should look at that.
Discussing that and what happens when something that sounds like a really good idea, it transforms itself into a measuring the wrong thing for the wrong reason because people don't improve it and constantly change it and upgrade it. And it becomes the management tool as opposed to the planning and change, the management of change tool.
Right.
Did that sort of make sense?
Yes, very, very much. Thank you very much for explaining that. I think those are very good points. And I think you don't want to be, you want to start small and try and measure a small number of important goals that you have. And also, I think, to what end did you want to increase referrals? That's a short-term objective, but to what end? To make more money for the hospital, for, I guess that's not necessarily a bad goal if that's what their goal is. But you need to think about why you're doing it. I mean, I think you sort of answered your own question too. You want to make sure you start small and just concentrate on some of the most important objectives. And think about the short-term, intermediate, and long-term objectives too, so that they fit hand in hand.
Are there any other questions?
Could I ask another? I don't want to dominate the conversation, but if there's no questions, how would you fit project management methodology into this schema? I mean, there used to be a big debate in management education of MBO, management by objectives, which this closely resembles, management by objectives versus project management. And how would you envision that sort of fitting in?
Well, I think you still need to know what your goals are and how you're going to measure whether you've achieved them, and then you can manage the project toward those ends, towards the ends, which are the objectives. I think the point here of this presentation is just to help you be really specific about what it is your goals are. It's not enough just to have these broad goals, but to figure out how to measure them so that you can show some results. And then you need to know how to track progress. If you're not tracking progress, maybe you need to think about how you're managing those programs a little bit better if you're not achieving them. You need to do then, that's that quality improvement activity where you're going to assess maybe the project management isn't going well. Maybe it's some external force that's causing you not to achieve your objectives, but you need to look at different aspects of it. I think project management needs to have program objectives.
Just checking to see, are there any other questions, comments?
Hey, this is Hondo Martinez from Faces, New York. I raised my hand. I don't know if you saw that.
Yes, hi, sorry. How are you?
I am well in yourself. Thank you for the
Good.
presentation, Sylvia and Deborah. I just wanted to say, as Ray was speaking, I was reminded of the example he was giving about arrest quotas with NYPD and other departments throughout the country, which has led to, a disproportionate arrest of people of color. And thinking along the lines of what Ray is saying, that these quotas are driven now by these metrics, right? It's like, it doesn't matter. We got to get the arrests, any means necessary, etc. And so I definitely enjoyed the presentation, and I just definitely wanted to acknowledge his Ray's contribution in saying, implement a program management and all of this stuff, but also be mindful that it's not losing sight of what its goal and objective is to achieve.
Right. Absolutely.
Thanks. Appreciate that.
Any other comments, concerns, questions? You'll see in the chat, I left a link for our poll survey. It helps us to determine what other skills building webinar series you would like to see in the fall. So please take a few minutes to complete that. Sylvia, any closing thoughts? I just want to say thank you again. I have learned something new today, something to go back and sort of think through a little differently, maybe practice on some of my smaller projects about how to begin to implement this in a way that is truly helpful in submitting our grants, and then just being able to give feedback to staff and our funders.
That's great. No, thank you. I'm happy. Deborah will send out my contact information if people have questions or need some other tools. There's a lot out there, certainly for health agencies on this topic, but I think there's probably other tools as well. We could do some digging if you need them.
So seeing that there are no other questions, I want to thank you again for your time, your energy, and your talents. And I want to thank you all for the work that you do for our communities. At the end of this recording, you will get an email with the link to our YouTube channel, along with also our next week's webinar series from the Ball community in celebration of June being Pride Month. So please come join us with Dr. Jennifer Lee. And we look forward to continuing to provide these webinars so that they meet your needs. And if there are things that you think that could be helpful, please just feel free to email me and I'll be happy to see how we can fit that into our schedule. So once again, thank you all. Have a great day. I'm going to stay open for a little longer so that you can please complete the survey. It's really important for us to be able to get those results so that we can share them with our presenters and also do planning for our fall semester and going forward. So with that, thank you very much, and we will stop the recording at this point. You have a bunch of thank yous, Sylvia, in our Facebook chat also.
Thank you. Thanks very much, everyone. Appreciate doing